Welcome to Facts TV News, where everything is true. The quick action of police from the Public Safety and Traffic Enforcement Branch led to the recovery of a Toyota Probox, which was stolen from the tax office in the corporate area on Thursday, August 19. The vehicle was recovered at a farm in St. Catherine shortly after it was reported stolen. British man jumps to his death at Negril Hotel. The Hanover police are now investigating a case of suspected suicide. 47-year-old British man John William Cohen is suspected to have jumped to his death from the third floor of a hotel in Negril, Westmoreland. Cohen, who is from Branley, England, arrived in Jamaica on August 15 for a vacation. It is believed that he might have been suffering from depression. Manchester man charged following shooting incident in Clarendon. A man has been arrested and charged with wounding with intent and illegal possession of firearm and ammunition following an incident on Busterman's Main Road, Clarendon on Tuesday, August 12. Charged is 28-year-old Lariston Hibbert, otherwise called Keke, of Java District, Asia in Manchester. Reports from the Mapen police are that about 6:20 p.m., a man was walking along the roadway when Hibbert opened fire at him. The man was taken to hospital where he received treatment. On Monday, August 16, Hibbert was subsequently held at the Asia police station whilst reporting as part of his condition in another matter. He was later transferred to the Clarendon Division where he was charged. His court date is being finalized. 48 beds donated for COVID wards. Jamaica have received 48 hospital beds from the Canadian Fund for Local Initiatives to support the expansion of COVID-19 wards. The donation, worth $11.3 million, was received by the Minister of Health and Wellness, Dr. Christopher Tufton, at the handover ceremony held at St. Joseph Hospital in St. Andrew on Thursday. Tufton welcomed the contribution and said it shows the importance of global partnership in the fight against the pandemic. The hospital as an institution and the healthcare workers have been very keen in providing support, so the beds are going to be very important, particularly now. As I said, we're seeing some nearly 90% occupancy in a number of our hospital COVID wards, he said. Tufton noted that the government will be taking the necessary steps in the coming weeks to ensure the safety of Jamaicans while containing the spread of the Delta COVID-19 variant. Damage from Tropical Storm Grace estimated at $172 million, stated Holness. The damage from Tropical Storm Grace, which passed over the island on Tuesday, has been estimated at nearly $172 million, a price tag that Prime Minister Andrew Holness has described as not a big bill. In terms of a financial cost, the damage caused by Tropical Storm Grace, the National Works Agency has given the Ministry of Economic Growth and Job Creation a preliminary cost of $171 million, just around that up to $172 million, disclosed Holness. That's not such a big bill, thank God, he said, while pointing to larger repair road bills caused by weather systems such as tropical storms Eta and Zeta last year. During his address at a virtual press conference to update the country on COVID-19 and other matters, Holness revealed that Tropical Storm Grace caused several communities to be affected, mainly by silt and debris, which blocked drains and resulted in flooding of some major roadways and damaging of road surfaces. Some parishes were assessed to be badly damaged. These would be Kingston and St. Andrew, Portland, St. Mary and Clarendon, he stated. In total, about 198 roads across the island were affected. We are now clearing 40 roads that were blocked, and I believe that by now all of them should have been cleared, the Prime Minister continued. We will make the budgetary allocations to return those roads to usual condition as quickly as possible, he added. Holness further noted that a bridge in Troy collapsed, however, work was continuing to clear the area. Despite the multi-million-dollar bill associated with the Tropical Storm Grace, Holness said he was happy to report that there were no loss of lives associated with the tropical storm. Jamaica records 556 new COVID cases, 14 more deaths. Jamaica recorded 556 new COVID-19 cases Thursday, bringing the total number of cases to 60,488. The country also recorded 14 additional deaths, bringing the country's death toll to 1,356. According to the Ministry of Health and Wellness, the deaths occurred between August 14 and 18. The deaths include 2 men from Westmoreland, ages 43 and 62, a 50-year-old woman from Manchester, a 79-year-old woman from Kingston and St. Andrew, a 93-year-old woman from Hanover, a 87-year-old woman from St. Anne, a 94-year-old man from St. James, and a 57-year-old man from Clarendon. 2 men from St. Thomas, ages 57 and 70, also died. The other 4 deaths were recorded in St. Elizabeth, 2 men, ages 51 and 88, and 2 women, ages 87 and 69. The cases were recorded in Kingston and St. Andrew, 117, St. Catherine, 88, Manchester, 84, St. James, 69, St. Elizabeth, 62, Hanover, 45, Westmoreland, 29, Trelawney, 28, Clarendon, 22, St. Anne, 11, and Portland, 1. The country also recorded 29 recoveries, bringing the total number of recoveries to 47,628. UWI says COVID-19 vaccine for students and staff for now will not be mandatory. The St. Augustine campus of the University of West Indies, UWI, says that while it has for now taken a decision that it will not mandate staff and students to be vaccinated against the coronavirus, its position may change based on if the matter is legislated or pronounced upon by the courts. In an email sent to staff and students, Pro Vice Chancellor and campus principal, Professor Brian Copeland, said given the ongoing public debate on COVID-19 vaccination, the campus had taken the position that, until such time as the matter is legislated or pronounced upon by the courts, we will not be mandating staff members nor students to vaccinate. However, it is to be noted that non-national students and staff must demonstrate to immigration officials that they are fully vaccinated with a World Health Organization approved vaccine in order to enter the country. He said the duty of the campus management is to ensure the safety, health, and welfare at work of all its employees and to provide and maintain a workplace that is free of known hazards. We encourage all staff and students to be fully vaccinated against COVID-19. The data clearly shows that the non-vaccinated remain most vulnerable, Copeland stated. WHO-approved vaccines are now widely available throughout the country and have been shown to provide an excellent defense against the COVID-19 virus. The more members of our community who are vaccinated, the greater chance we have to suppress the COVID-19 virus and the production of mutations. This is also the swiftest path to a full return to campus, he said. Copeland stated that one exception is the case of the House of Residence, where only fully vaccinated students, whether nationals or non-nationals, will be allowed to stay. In any event, non-national students will have to be fully vaccinated with a WHO-approved vaccine in order to enter the country to take up study, he said, adding that only 2 halls of residence will be open for the arrival of residents from August 29. Although there remain a few details that need to be worked out, there is agreement on the need to do all that is necessary and possible to ensure that the staff and student safety is of the highest priority. For staff, details will be included in a revised return to work policy, which will be shared in the near future, he added. The Trinidad and Tobago government has said it has no intention at the moment to implement a mandatory vaccine policy, even as it urged citizens and residents here to fully participate in the national vaccine program, allowing for individuals to decide which vaccine they would prefer to take. Trinidad and Tobago has so far recorded 1,208 deaths and 42,582 positive cases of the virus, and the government has signaled its intention to extend a state of emergency by a further 3 months when the current SOE ends on August 29. In his statement, Copeland said the University of the West Indies had to treat with the challenge of the novel coronavirus pandemic for almost 18 months, and the resilience that the campus has shown has been inspiring. I thank all members of staff who have continued to diligently serve our student community. To our students, your perseverance, despite many challenges over the past months, is commendable, he said, adding that the plans for the 2021-2022 academic year will continue to be guided by national protocols and the public health regulations. Likewise, our planning and position on matter for the new academic year is the result of careful planning, consultation across campus management, and engagement with our incident management team, unions, and student leaders, he added. The new academic year will begin on August 29, and Copeland said that given the current situation of uncertainty around the pandemic, the online delivery of classes will continue for semester 1. However, faculties have been asked to deliberate on the arrangements for labs, field exercises, research, and any other activities that absolutely require an on-campus or in-person presence. Of course, all COVID-19 protocols, physical distancing, sanitizing, mask wearing, temperature testing, and attendance logging must be observed. Further, faculties are asked to be flexible in the scheduling of program activities to minimize the clustering of students on campus. Faculties are also asked to coordinate with the library to make arrangements for safe access by research students, he stated. Please remember to subscribe, like, share, and click the notification bell for daily updates.